Well, hi class. My name is Maisha Gray, and pretty much I'm just going to go over my slides for my critical assignment and kind of just break it down word by word and fact by fact in order for you to get an understanding of why I chose rugby as my sport and the three most common injuries that I decided were very important to discuss, and also talk about rehabilitation and preventative approaches. So let's get started. Awesome. Well, let me start off by saying that rugby is one of the most culturally profound sports that I can think of for young females and young males to be involved with. With that being said, that cultural foundation and connection amongst rugby players is something that is worthwhile. I think that that's something that really drawed me to, or pretty much just got me to like and show an interest in rugby overall. Also, traveling to New Zealand, that also helped me out a bit because I got a little more in tune with the culture and the overall game of rugby. Also over there, I was able to be placed with a rugby team to practice certain techniques when it came to physical therapy in my studies. The game of rugby is quite unique. Rugby is New Zealand's national game, like football is for the US and all over the world. It is a pretty popular sport to play. The one thing that is pretty cool is the fact that it's very much enriching and grounded with a connection to the Maori culture. This part is cool because the beginning of the entire game starts off with the haka, which is potentially a war cry or a battle cry, in which honors the opponents and shows a sign of respect, which is something that I found to be quite interesting. Now, thinking of rugby and football, they can be pretty similar, being that they're both collision-based sports. And with that being said, there comes many injuries with playing this form of game. Throughout my studies, my goal was to gain an abundance of new knowledge regarding the injuries and prevention of these injuries, as well as the cultural factors of treating and recovering amongst college rugby players, female and male athletes. Now, the first slide that I will be presenting will have to do with shoulder dislocation, which is one of the three injuries that I felt was most common amongst rugby players. Now, when identifying a shoulder dislocation, whether that's anterior or posterior, there's a visible disformity of the shoulder. Awkward positioning of the shoulder, whether that's them holding their arm a little too close or just being a little more cramped up. There's also swelling and inflammation and a lack of ability to physically move efficiently. Now, to get a little more in detail of a shoulder dislocation, we have to understand the shoulder as a whole. Now, the shoulder is a ball and socket joint, which the glenohumeral joint is what's being dislocated. If it's an anterior dislocation, then that glenohumeral joint or ball and socket is being dislocated or shifted forward. If it's posterior, then it's backward, and even sometimes downward, and it can cause minor tears, trauma to the stabilizing ligaments surrounding the shoulder joint. Now moving into the mechanisms of injury, which include the extreme trauma or blow/hit, even an impact to an externally rotated, hyperextended, or violently abducted glenohumeral joint. Now, one of the most common forms of shoulder dislocations is an anterior shoulder dislocation, which can occur when the humeral head of the shoulder joint moves or shifts forward outside of the natural anatomical shoulder position. Treatments for an injury such as this could include splinting, which is a type of device, prescribed medication to control pain, physical therapy, or even surgery. In slide 4, I give a thorough breakdown of 3 to 4 rehabilitative exercises, preventative exercises, as well as assessments that could help you when it comes to identifying and treating a shoulder dislocation amongst rugby players. The second injury that I'm going to discuss is an ankle sprain, particularly an inversion ankle sprain, which when assessing or looking at an ankle to try to diagnose or identify this form of injury, you want to make sure that you're looking for signs of discomfort, the increased amount of swelling, inflammation, tenderness, lack of balance, mainly that. And an ankle sprain, an inversion ankle sprain, is violently inverted ankle joint, damaging the lateral ligaments of the ankle complex. The mechanism of injury associated with ankle sprains and inversion ankle sprain is severe pain and trauma of the major lateral ankle ligaments, the ATFL, the CFL, and the PTFL. This form of sprain occurs due to non-contact as well as contact when there's an applied force on a violently inverted ankle joint. Some treatments for this form of injury, such as an ankle sprain and an inversion ankle sprain, can be manual therapy, regular physical therapy, rest, ice, compressed, and elevate, which is RICE, a splinter brace, and some common examples of exercises that I feel would potentially help to rehabilitate an ankle inversion sprain would include ankle or toe alphabet or tracing. So for me, when I rolled my ankle, I would spell my name out in the air with my ankle rotating and my toes pointed, moving in that direction for about 2 sets of 30 seconds. Some of the assessments that can be utilized for an ankle sprain or an inversion ankle sprain would be palpation of the lateral and posterior section of the ankle. Also, you could do a balance test in addition to just physically observing your patient. The last injury that I would like to discuss is an ACL rupture, which is an anterior cruciate ligament tear. This is something that every athlete is scared of, including myself. This form of injury occurs when there is a violent hyperextension and or twist of the knee and can result to an ACL rupture. Now, moving along with that, the mechanisms of injury will consist of a sudden shift of direction, which could happen when you're tackling or trying, violent internal rotation, or just intensified hyperextension of the leg or knee. And this could all lead to this serious injury. Now, this form of injury is very serious. It's a musculoskeletal injury that occurs when the tissues or ligaments of the ACL completely tear or disconnect from the femur to the tibia, where those are the main connecting points. Now, this can also be treated, this form of injury, it can be treated through prescribed medication, which is also a pain controller, which helps a lot, but there's other things that might have to be done in order to fully recover from this injury, which you could go through physical therapy or even get ACL reconstruction surgery. Now, when we're moving along to those forms of treatment, If we were to go into the physical therapy route where they're exercising and getting that ligament and the surrounding muscles back into shape, strengthened and challenged, then we want to make sure that we break down a thorough workout that will really help to prevent and rehabilitate this particular injury, which can include heel raises, prone knee flexion, or passive knee extension. Now, in order to assess an ACL rupture, you would need to visibly observe the injured area, palpate the knee, and just test for sensitivity, tenderness. Also, make sure that you receive an MRI to get the proper imaging to make sure that you don't overdo it when trying to figure out the injury or rehabilitate the injury. Also, last testing that you could possibly do to assess an ACL rupture would be a Latchman test.